Well, as the United Kingdom prepares for the Brexit deadline, it is also at the start of another major national project, the coronavirus vaccine rollout. Yesterday, Britain became the first country in the world to launch its vaccination programme. Elderly people and healthcare workers are the first in line. But its medical regulators issued an urgent statement today warning that people with a history of allergies should not get this vaccine. Well, for the latest, let's go to London and talk to our reporter there, Bénédicte Paviot. Bénédicte, what can you tell us about the concerns that have been raised today?
Well, this important advice from the British regulator saying that people with a history of significant allergic reactions should not have the Pfizer BioNTech COVID jab. This applies, they say, to people who have had reactions to medicines, food, or vaccines. And the two people who had the reaction yesterday, two National Health Service workers, had a reaction shortly after having the jab. They've had treatment. They're both fine now. It's interesting to note that they have a history of serious allergies and that both carry adrenaline pens around with them. So they had what is called an anaphylactoid reaction, which tends to involve a skin rash, breathlessness, and sometimes a drop in blood pressure, I understand. This is not, repeat, not the same as anaphylaxis, which can be fatal. So the reaction of Professor Stephen Powis, the medical director of the National Health Service here, said both individuals are recovering well. This is common with new vaccines. Indeed, we know it happens. For example, there are reactions with the annual flu jab. It's important also to underline that this does not affect the rollout, which is in its second day, of this massive vaccination program, a first in the UK and also in the world with this Pfizer-BioNTech jab. And also, it's important to say that 1,000 people in those that have got coronavirus have died, and that we have already had 62,000 people die from COVID-19. So that is what is really concentrating minds here. Apart from this, it's hoped very small reaction from two people who are now recovering and are well.
All right, Bénédicte Paviot, thank you very much indeed for bringing us the latest.